Hello. Hello everybody. Welcome back to our live YouTube channel. Now I feel more confident as a very good YouTuber. Huh? So today we have a very nice case, and I would like to share with you this case. This is a female patient. ¿Cuántos años tiene? With 52 years old. So this patient have chronic liver disease, but the problem of this patient is that we don't have any etiology until now. So recently the patient started to perform new elevation of hepatic enzymes. So we are thinking that this patient probably have autoimmune hepatitis because she doesn't have any history of overweight or to think in an NASH or viral hepatitis. So the situation is that the autoimmunity is not present in her, and we don't have any confirmation. So today we want to do a fine needle biopsy of the liver first, because we need to know if this patient needs to receive any other treatment in addition. And second, I will provide to evaluate the Shear-Wave technology. This is a new technology of endoscopic ultrasound, very similar to FibroScan, same technology, and to evaluate also the liver of this patient by Shear-Wave and to compare with biopsy. You need to remember that the Shear-Wave technology in the evaluation of the liver have a lot of advantage, especially for to know to predict the evolution of the patient. For example, if this patient have a very hard liver or tissue, hepatic tissue, the risk of development hepatocarcinoma or the end of the disease is high than less hard tissue. So Shear-Wave is a technology that can give us a quantity in kilopascal of this tissue, in contrast to elastography. Elastography is a very good also technology that can help us, but I believe that the future will change with this new technology that is Shear-Wave, that is already available in this Pentax Itachi Aloca technology. So now I am showing you the strain histogram of this patient, of the liver in general. So the mean is 76.33 of the histogram. It means that this is a hard tissue, because the normal tissue is more than 100, and it's very good to show this. I will try to focus a little bit more. So this area is not so hard tissue. So now I would like to compare with Shear-Wave technology. So you need to remember that this strain histogram or strain radio or elastography until now just measure the gray scale. So the mean is 85, so it's a hard tissue. So we have two measures showing that. Now I will show you the Shear-Wave technology, and we are at the level of the liver, left hepatic liver, and I will start to do my Shear-Wave evaluation. So for this measure we have 28 kilopascal. So it means that this is a very hard tissue. Normal liver tissue in Shear-Wave technology is until 5. So more than 5, it means that it's very hard tissue. So we can take samples from different areas. 22 kilopascal. Let me see here. Again, 22 kilopascal. Fourteen kilopascal. It's like you are taking biopsy from a lot of areas of the liver, okay? I'm going to take this here. 38 kilopascal. This is very hard tissue. So probably in the future this can help us also to guide where we need to take the biopsy. Because if I take a biopsy from here, I will just have liver cirrhosis and advanced disease. But probably in the areas where we have less hard tissue, we can recognize some parameters that at that moment can help us to evaluate if this comes from autoimmune hepatitis or another kind of disease. So I know that this patient have segments of liver that are very hard. In mean is more than 20, and probably the prognostic of this patient in the future is so bad because the development of hepatocarcinoma is higher than 30 to 40%, as is described before, not in the US but just in Shear-Wave technology. Okay, so I will use now today also a new needle from for Latin America, not for worldwide. This is the Charcot biopsy needle, the Night and Gauche biopsy needle. This is a very nice needle. First, because the first study of liver disease were performed with this needle. This is from Medtronic, and one of the big advantages is that we cannot. It is not necessary to remove the plastic part of the needle. So these help a lot to avoid damage also in the scopes. So now I will evaluate here. So 29. So you see in the monitor we see a lot of measure: 22, 28, 22, 22, 14, 38, 29.9. And we can do some measures from other areas of the liver. So my idea is to evaluate or to take a biopsy from another region, or another area of interest. So maybe of this area we have less hard tissue. I am trying to evaluate 23. I don't need to confirm maybe this area. This is a good area. So I don't need to confirm the liver disease, the liver cirrhosis. I need to confirm what kind of chronic hepatitis this patient have. So you can see now 13. Maybe this is a very good region. I will show you here. Maybe this is a good region to take my biopsy. Ok, entonces necesito la aguja. ¿Dónde está Clever? So I need to go to this area. This is not proved now as you know. It's just logic. I am trying to apply my logic. So this is the needle. You see here. The shark core. ¿Puedes abrirla? So, retira el estilete, que es este que está aquí. Okay. So you can see here the shark core is a different kind of needle that help us to have a better tissue for evaluation. Okay, so guárdala y el estilete. Okay. So now I am using the endoscope. This is the J10 series scopes from Pentax Medical. And it's necessary to have Hitachi Aloka 850 to have this technology in your units. Okay. So now I will fix now. So my idea is to go to this part, this segment of the liver. Necesito retirar el estilete. Retíralo todo. We don't need this. Hard tissue, huh? So now without aspiration I will do my biopsy now. I'm trying to see very well my needle. You see the needle there. And I'm trying to reach the area that I already select. Dame un segundo. Let's go to see the quality of this needle. This is very important. I will do a small aspiration. Pequeña, menos. 5. Just a small aspiration, huh? I like the aspiration. Opa. Okay. Ok, ahora hay que sacar esto. No necesitamos sacar esto, necesitamos sacar esto, no. So now, you see, I am just taking off the needle. My plastic part is inside. Sí sale. Perfecto. You can show. Déjame mostrar. So, you can show it. You see? So now we retire just the estilet, the needle, and we continue with the plastic part inside. I see my plastic part here. Very good tissue. Very nice. Not blood. So I am very happy now. Ok, terminamos. No, 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 no. Ahí nomás. Un momento. Déjame mostrar. Ok. Pone un poquito de aire, pero no tanto. Okay. So now I will show you the quality of the needle. Huh? Look. Without aspiration. So I think I have very good tissue now. And I take my biopsy from direct target. Okay. So I don't believe that I don't need another one passage. So I finish. I continue with my needle here, with my needle inside my scope. I don't know if we can show. Quiero ver la aguja. Aquí. No, no, la aguja. Eso, muy bien. So you can see here, my needle is there. ¿Podemos verla? And we can do a reinsertion of the needle, go inside. But not today. You just need to push here to put again the needle, and the needle goes inside. So I will take off everything. I think we finished now. A very nice case, I think, and I think the combination of Shear-Wave in the future with the needles will be fantastic for certain cases of liver disease that we have today. Show it. Thank you so much. Terminamos la demostración. Gracias.